There's also neurochemical imbalances. If there's any alteration in neurotransmitters such as dopamine and serotonin, which affect the mood and thought, they can make an individual being vulnerable to having a PPP. And the last under this biological factor is sleep deprivation and physical stress. The physical exhaustion of childbirth and caring for a new baby, especially in the absence of support, can trigger or increase the possibility of psychotic symptoms because of the physical stress of having baby. Another cause is psychological factor, such as history of having a mental illness, such as depression, bipolar disorder, anxiety. Most women who have previous episode of this, they should be watched for PPP. The next one is unresolved trauma. Past experiences of abuse, of violence, of loss can resurface during postpartum period. Some women who have incident of postpartum psychosis, some of them have been found to have a childhood trauma, or they have been sexually abused, and the birth process now amplify the already psychological strain they are going into. Like I have earlier mentioned, these two I mentioned are global. It can be obtainable all over the world, but these sociocultural and environmental factors can be very unique to Nigeria. One of the sociocultural and environmental causes in Nigeria are misconception and stigma. In Nigeria, those individuals, they are seen as somebody with they have spiritual attacks, they have witchcraft, they have evil forces. In fact, some of them will feel that they are paying for the sins of their forefathers, that God has caught up with them. They will, in fact, they will confess what they have done in the past. So this is one of the problems. So instead of giving them immediate help, they are allowed to suffer. The next one is domestic violence and marital conflict. Intimate partner violence, emotional neglect, and lack of spousal support can increase severe stress, leading a woman who just delivered to break down. Poverty and hardship is another one. When there's financial hardship, a woman is postpartum who is supposed to be feeding well and be taken good care of. When poverty now compounds the problem, there's every likelihood of triggering it. Then substance use of substances, which I'm still going to talk about when I'm going to discuss the Nexus. I will talk about substance use and postpartum psychosis. The next factor is social isolation and lack of support. There are evidences that women who are not supported, either due to urban migration, we call it absent husband, or one partner being in one location or the other, absence of extended families, like we know that people are moving for greener pasture, and minimal community support system can make a new mother feel overwhelmed and alone. As a result, it can come up. Cultural practices around childbirth can lead to postpartum psychosis. For instance, some women can be confined in some community that they will not serve food because they are still having a post-birth vaginal discharge, lochia. As a result, they are confined from serving food or participating in ceremonies. The last factor is medical and obstetric factor. When there's a complicated delivery, some women can have traumatic birth experiences, cesarean section, or neonatal loss. Sometimes women who lost their children during childbirth, some of them develop postpartum psychosis as a result. And the last is infectious and medical condition. There are some medical conditions such as eclampsia, that is swollen toes and displays, can lead to postpartum psychosis. Now, getting to my discussion for today, which is the nexus between postpartum psychosis and drug abuse. Evidence have shown that there's a significant relationship between postpartum psychosis and drug abuse because of the following. Number one, drug use or abuse can trigger a psychotic episode. There are some drugs such as cocaine, amphetamine, cannabis. They can trigger a woman who just delivered to have a psychotic episode. Secondly, drugs can worsen underlying condition. There are many individuals with substance use disorder. They have concurrent mental health conditions like bipolar disorder or schizophrenia. And when they are on drug, it will likely make them to be more predisposed to having postpartum psychosis. The next is sudden withdrawal from substance after long time use. You know that during childbirth, even before childbirth, during the antenatal, women are advised, they are counseled, they are discussed, they are told not to be using drugs. So some who really want to adhere to the in their attempt to withdraw, some can have a dramatic incident of a postpartum as a result of a withdrawal from a long-term use. And another nexus or relationship is it can lead to diagnostic confusion. When a woman is having postpartum psychosis and is also having a drug abuse or drug-related issue, isolate the causes and possible treatment I mentioned for such a client. In addition, who just gave birth is already having that is what we call self-medication. As a result of the pains of a uterine contraction, some of them who have a cesarean section, the bleeding, all these physical conditions with a more pains of caring for a new baby can resort to self-medication. And one of the self-medication is to use alcohol or to use drug to reduce the level of pain. Delayed treatment, those because of stigma that I have earlier mentioned, and fear of shame and feeling of what will their in-laws, especially their in-laws, say if they hear that they are assessing treatment for drug. It could lead to delayed treatment. And when it leads to delayed treatment, it can result to postpartum psychosis. And the various treatment innovation for postpartum psychosis. Postpartum psychosis is highly treatable, especially when recognized early and managed through integrated, compassionate, and evidence-based care. Recent innovations combine both medical, psychological, community, and digital approaches to ensure that both mother and baby receive holistic support, even in a resource-limited settings like many parts of Nigeria. Now, let me give us a detailed description of what we mean by integrated, compassionate, and evidence-based care. Being integrated is a combination of both medical, psychological, making sure that it's multi-sectoral. Every sector is involved. So the issue of a medical standing in between is no longer an innovation. It's now like you call your colleague who is a similar, you leverage on your strength according to the different professions. One, there's pharmacological advances. That will mean that a pharmacist will be involved. There are some drugs like medication that can be given. There are mood stabilizers that can be given by the pharmacist. And we also have psych and psychosocial innovation. Under this is even where some of us even now come in, because in the past, what is the business of a counseling psychologist? Postpartum my business is now here. My counseling psychologist is to offer psychological intervention. And under this, we have cognitive behavioral therapy. We help to especially when it has to hallucination, delusion, you begin to work on realigning the mother's harmful thought, manage anxiety, rebuild confidence, self-esteem that was lost. So that is using different form of cognitive behavioral therapy. We have family-based therapy, which will involve bringing the husband, the mother-in-law, the family members, because by bringing them into treatment, it will reduce stigma and you create a stronger support system at home. So there wouldn't be, the issue of stigma will be reduced. There's also one of peer support network, and that will mean connecting them to mental health champions. For instance, there are individuals who have experienced this challenge in the past, and when they talk about it, it is very therapeutic. For instance, in the beginning of this presentation, I could hear some testifiers talking about what they went through, how long they stayed in the rehab. So some of this peer support help them to come up strongly. That is why it's innovative. The next is culturally sensitive counseling, integrating spiritual beliefs and traditional values into therapy, because it's not like you begin to tell the individual that you people are so traditionalist, you don't believe. No, it's acknowledging the strength of what the individual have and embedding it with what is acceptable. That is what makes it culturally sensitive counseling. The third one rather, is integrated care model. Under integrated care models, we talk about having mother-baby units, not the idea of separating them as it's usually done in the past, collecting the baby from the mother, and one of the concern of the woman in postpartum will be asking you continuously, where is my baby? Where is my baby? So trying to respond to that issue of where is my baby is even more traumatic than the postpartum psychosis itself. So this time we talk about having them in the same unit so that they can bond, allow mothers and infants to stay together during the treatment. I know an instance when one of my colleagues then, she had the issue, they had to discharge the child. The child has to stay with the mother-in-law in the house while the woman stays in UCH for a very long time, if it's not up to 3 months. Each time you come to visit the woman, she'll be asking you, where is my baby? I've not seen my baby. Where is my baby? I've not seen my baby. So the people the child will be meeting at the first instance will be the mother-in-law, the other extended family members before the mother himself. So now we are talking about mother-baby unit. And the next one is combined substance use and mental health treatment. This new model will integrate dual diagnosis care, treating both substance dependence and psychosis simultaneously. So not that they will send the patient to a clinic just for substance use and another one for psychosis. No, having both treatment centers together. And the next one is the community mental health outreach, like those that is proposed by National Mental Health Policy, which aim to decentralize care and bring postpartum mental services closer to rural women. Because you will notice that in Nigeria, even in this Oyo state, I wouldn't know how many centers that are giving postpartum mental health care, except maybe some of these big facilities. So they should be able to make services nearer to individuals to enable them just walk in. The fourth one is digital and technological innovation. Of course, these young mothers of these days, I don't know how many of you have been seeing them. When I say young mothers, in our own generation, there's nothing like a baby shower, going to open stomach before the delivery. Now, it's very glamorous that people will open the full stomach and the part of their V to do baby shower. So this particular young people that are ICT migrant, we are meeting them there, their generation, that Gen Z and millennials. For you to be able to meet with them at their point, we have to resort to digital and technological innovation, which means giving telepsychiatric and mobile application, using WhatsApp, using Zoom or specialized app to support mothers, even in rural area. Send messages, follow up, I've forgotten what we call it, something on, I hope you are doing well, there's life after this, and so on and so forth. So the next one is digital education platform. having a platform whereby issues are discussed in Yoruba, the three Nigerian languages, even more, raising awareness about postpartum mental health and encouraging early help seeking. If you are feeling this after birth, this is what you are going to do. They talk to them in both English and Hausa. I know that in Nigeria, we do prenatal care very well, that even rural women have come to accept it and they are willing to go. But this postpartum, after delivery, once they give you 6 months or whatever in UCH, or that is the end. There's a need for continuous follow-up. And the last one is AI-driven screening tools. Imagine tools, use short questionnaire to screen new mothers for early signs of postpartum psychosis and depression during their routine. The last but not the least is community and policy innovation, training traditional birth attendants on how to early recognition of women with postpartum psychosis so that they can be a strong caregiver in that area. Training faith-based and NGOs, making sure that any individual, because we know that some churches, they are the one who deliver their babies by themselves. For instance, my husband's church, their parents went to this I don't know why this name just went off me now. I will still remember it by the time we finish. This particular church, all their siblings, all of them, they are delivered at home. Nobody goes to the hospital. If you are lucky, the person that will do delivery will be the pastor's wife. That is how they have been doing from generation to generation. It's not new. They don't take paracetamol. They don't take any drug. They're nothing. And they all survived it. After all, he survived it. That's why we are even happily married. He survived it. If he didn't survive it, I will not say, maybe I would have remained single. So they have to be trained, and they should be brought up and trained on the signs and symptoms. We shouldn't just leave them behind and be doing medical. The next one is policy reforms and advocacy. There's need for strong policy reform and advocacy on maternal mental health, especially in this Mental Health Act of 2023, so that we have a more standardized, a rights-based care for postpartum women. When I say rights-based care, it means that they are entitled to that care, not that we are giving them to them as a favor. All this, not forgetting nutrition and physical wellness and so on. But incidentally, there are barriers to care in Nigeria. Like I mentioned, I've just mentioned it briefly: stigma and misconception, preference for alternative treatment. Do you know that even some families, they will believe that anything about mental health is best to be resolved in a traditional health center than hospitals? There's this misconception that take them to traditional herbalists and healers. The next one is financial constraint, either because of the money. These are the barriers that are preventing even the women who are willing to care for, because they do not have adequate funding. There's also low awareness. Most women and most families, even husbands, they did not know that something like a woman who has been pregnant for 9 months will suddenly become ill and be behaving as if the person has some element of madness. So there's need for increased awareness. I want to briefly be concluding by saying that postpartum care is very essential if we will achieve anything. Getting women to go for postpartum care. In conclusion, in Nigeria, some of the symptoms of postpartum psychosis are sometimes mistaken for spiritual possession, witchcraft, or the effect of evil forces. This misunderstanding often delays treatment. Public education and culturally sensitive mental health awareness are essential to ensure mothers receive medical help quickly and compassionately. The consequences of undiagnosed or untreated postpartum psychosis are severe and have been observed in all cases. Treatment innovation for postpartum psychosis are therefore moving beyond medication toward holistic, family-centered, and culturally aware care. With the right combination of medical science, technology, and community compassion, recovery is not only possible, but deeply transformative, allowing mothers to reclaim joy, connection, and hope. I want to appreciate you all for listening to my discussion. Thank you and God bless.
All right, we had actually to thank you, Dr. Ndidi Mercy Ofole. Dr. Ofole is an associate professor of counseling and health psychology at the University of Ibadan. Thank you very much for speaking with us and sharing insights with us on this particular topic today. We appreciate you very much, madam. Okay, quickly, before we go into reading your questions and taking your contributions, for those who may want to speak live on the space, please, this is the time for you to request that we move you over to the speaker's corner. Otherwise, you can continue to send your messages to our DM. Will definitely be reading them one after the other. All right, once again, we'd like to appreciate everyone that has joined us from across the globe this hour. Thank you very much, Femi Ladiran Muhammad Bafo, Victoria Ochechi, that's our regular. Thank you very much. Ayo Ayeni, Sani Abdullahi, Funsho Jimo, Dr. Dimeji, that's Avata T. Opportunity, that's at Debayo Deolu, Pete, Abiodun Titilayo, Nura Ahmad Musa, Jelly, that's at Lead Ademola, Health Situations at Ngozi Ibe. Like to congratulate you, Ngozi, for your recent program. Congratulations. I struggled. I tried as much as I could to be there personally, but the circumstances were beyond me, and that's why Francis represented. All right, we also acknowledge Edo Princess, Winnie Ibrahim Oladele, the law, Isaiah Ashimogo, another regular on this space. We have some of our officers, Euphemia, Asma Ahmad, Asma is joining from Kaduna. I have also a senior officer of the agency, indeed a director, Patricia Folabi, thank you. I believe that's you. Samuel Adedoyin, Dr. Jonah Kolo, that's the man coordinating our alternative development program. Thank you very much, Dr. Kolo. Uthma Mikhail, Iranshele Dumare Itohan, Inda. Let me take a pause there. We'll continue with some of the recognitions. I want to especially appreciate all of our compatriots joining us on our Facebook page, as well as those joining us on our YouTube channel. Thank you very much for being part of the conversation today. Now, let's quickly take some of our reactions, our contributions, and questions before the time runs out on us. Okay, I think I have seen Victoria Ochechi showing interest. Please unmute yourself and let's hear from you. Victoria Ochechi, please go ahead.
All right. Can you hear me?
Very loud and clear.
Loud?
Very loud and clear.
All right. Thank you so much. All right. Thank you, Dr. Mercy. Thank you for this wonderful presentation. Thank you, NDLA, for this initiative. Thank you, Sir Femi, Baba Femi. I really appreciate it. Like, this is really amazing. It's really saving lives. Okay, my question goes this way, or I really want to clarify something. Ma, you say something like symptoms of this postpartum psychosis actually develops immediately after childbirth, like from 2 weeks, if I heard properly. Then I want to know, you say something like for substance users that it actually triggers it. Okay, I want to know, is it that it triggers, okay, that means it triggers it like this, it makes the symptoms comes earlier than non-substance users. That's what I want to get. Meaning substance users, their symptoms can appear earlier before compared to non-substance users. I don't know if you got the question.
I got it very well. I don't know the modality. Should I respond to yours, or I should wait until?
No, please go ahead. Please go ahead. It's one after the
Okay.
other. Yes.
Yes, I think she has two major questions about the commencement. Yes, truly, when a woman after delivery, the woman is put under observation for the first day to 2 weeks, and sometimes it may not even uh, start immediately. Like I said, it can be sudden. It can the timing or when it is going to commence, it is not defined. Anything can trigger it all. Then when it comes to the drugs, yes, the second part you ask, yes, drug can trigger psychotic episode. You know, the episode can be very dramatic. Someone you are dealing with in the morning will suddenly change. So if someone is drug, not the normal drug that the doctor prescribed, the drug that can help to either, I mentioned some of these drugs, cocaine,
Yes, I understand.
it can trigger off a psychotic episode. And drug can also worsen underlying conditions. That is why when you want to take any drug, they will ask you, are you an ulcer patient? Are you diabetes? Because there are some drugs that can counteract to bring a negative outcome because of the composition of each drug. So even a drug as well as alcohol, there are some treatment that you take, they will ask you, giving malaria treatment as little as it is. Before you are giving malaria treatment, they will ask you, some very good medical personnel will ask you, do you take alcohol? And most importantly, do you know that in surgery, alcohol can make people not respond to anesthetic condition. They will need higher doses to put them into sleep. That is as simple as it gets. You can now imagine when it has to do with postpartum psychosis. I don't know if I've been able to address your concern. So, drug truly is a significant relationship. Yes, thank you very much.
All right, thank you, ma'am. Thank you.
All right, thank you very much, there, Victoria Uchechi, always on the platform. Thank you very much, Dr. Ofole, for your response. Indeed, quite insightful. All right, let's go into our DM now. Quite a number of questions, but we'll be taking them one after the other. This is coming from Omofele. Omofele, thank you very much, Dr. Ofele, for your presentation. Indeed, quite a lot of eye-opening facts in there. I would like to ask, can traumatic childbirth, traumatic childbirth experiences trigger both that's PPP, postpartum psychosis, and substance abuse, meaning that for someone that has difficulties giving birth, can this trigger PPP and substance abuse? Thank you. All right, you can go ahead now, Dr. Ofole.
Yes, it can, like the name suggests, traumatic experience. Anything trauma, any individual going trauma, look for how the trauma can be addressed. And sometimes people resort to unhealthy behaviors in order to address traumatic experiences. Some individuals who are exposed to severe pains, in fact, it is even now that I wouldn't say that I wish, because I had a cesarean section. I had a set of twins. By God's grace, they are grown up. When I had these twins, thank God we were not exposed to knowing what to take. Now you can walk into any pharmacy and be telling them anything you want. But there are heavy pains that come with trauma of the childbirth that you wouldn't think of the consequences. What you are bargaining for is how to reduce the pain. So truly, traumatic birth experiences, they have a high relationship with, especially those who are already having tendency of doing such things. There are some who are never religious before, but after childbirth, traumatic childbirth experiences, some of them get converted to one religion or the other. And as a result of this knowledge, religious bodies, religious, both Christians and Muslims, they capitalize hospitals to get their converts. Some people, when they are giving testimony, they tell you they got born again while they were in the hospital. It's because they are resorting to how to handle the trauma they are going through. So why some will adopt healthy means, others will take unhealthy means, which is drug use and drug abuse. I don't know if I'm able to attempt your question. Otherwise, did I address it, please?
Well, the person is the messages are dropped online. I believe if the person is not satisfied, she would definitely send a follow-up question. We believe you have responded appropriately. Thank you very much,
Okay,
Dr. Ndidi. There. Let's take the next question. And this is coming from Babatunde. Babatunde, thank you for your presentation, Dr. Ofole. I would like to, when you were speaking on the preventive methods or interventions, I was looking forward to hearing something about family counseling, the likelihood of that reducing PPP in women or even turning to drug for relief. What's the place, since you are a counselor yourself, what is the place of family counseling in all of this? All right, thank you, Babatunde.
Thank you very much. I'm very impressed that my listeners are very active, So under it, I mentioned psychotherapeutic and psychosocial innovation. Under it, I talked about family-based therapy, where I specifically mentioned that husband should be involved, mother-in-law should be involved, family members should be involved in order to reduce stigma and create stronger support system at home. Incidentally, this involvement is well perfected in antenatal clinic. So we need to scale it up to postpartum, where they are involved to be counseled on how to support this individual, not only to recover, but to be integrated into the family system to enable him or her, to enable her to contribute actively to the family. So as a counseling psychologist, I mentioned that this is the aspect, this is the component that we are more into, giving this support, giving follow-up, linking them to support network of those who have gone through similar things, and making the counseling to be culturally sensitive. Thank you very much.
All right, thank you very much there, Dr. Ndidi. Let's take the next one from Uchena. Uchena is also appreciating Dr. Ndidi for the brilliant presentation, and then he or she goes on to ask, you mentioned spiritual and traditional interventions when you were speaking on some of the treatment innovations, and we do know about the spiritual interventions, such as going to mosques, such as going to churches for prayers and all of this. And then, but the traditional, you weren't clear on that. Does it mean consulting traditional tradomedical people or herbalists? Please, I need you to be explicit on this. All right, thank you, Uchena. Please go ahead, Dr.
Yes, thank you very much. Actually, the aspect I mentioned them is on building their capacity, because sometimes we pretend they do not exist. But studies have shown that some people also seek services there. If individuals seek services there, we should now bring them on board and tell them the best means and what they should do. So anytime there's a training, this group of people should be targeted. It shouldn't be only medical professionals or those of us who are here and there. It should be such group, faith-based organization, community-based organization. Their capacity should be built. But now, let me tell you the truth about this trado medicine. That is an aspect that most people do not want to discuss. But increasingly, there are evidences that some of this, there are some traditional medicine that can do one thing or the other. One of them I know very well, which I have tried, is bitter leaf. If you want, I'm not suggesting for anyone who wouldn't know that bitter leaf, as bitter as it is, will help in reducing sugar level, because it's obviously very bitter. But you know that it's part of the trado. There are some treatment, even in my culture, Igbo land. When you have a baby, there's a pepper soup they will cook. By the time they give you this, uterine contraction will go by itself immediately. It does not waste time. By the time they put it and do the concoction, I'm sure Femi would have known it because he seems to have well traveled here and there. When you eat that pepper soup with the spices, so if your contraction, if the contraction will go, if the contraction will go as a result of those tribal cooks, fine. There's not that it will be a substitute for it, but some people take it because they have intensive pain after birth. And one of the ways they cook is to take the pepper soup to remove the blood, because they need hot water and hot things to drink. I'm not advocating unorthodox, but I'm saying that the capacity should be built in knowing what to do and the limitations of each. Thank you.
All right, thank you very much there, Dr. Ndidi. Indeed, let me tell Dr. Ndidi that I do know the pepper soup you talk about, but I've never tasted it. But if you ask me about Ofowere, I can tell you about Ofowere.
You have never eaten the pepper soup, but that is not there.
All right, thank you very much, Doctor. Okay, I saw a question coming from Femi Ladira. Femi Ladira is on the space and he's asking, is postpartum challenges related to narcissism? Please elucidate. All right, so somebody on the space just sent in that question. Is PPP related to narcissism? He wants an explanation.
No, they are not related. You see, narcissism is a personality. It has to do with personality disorder. It's an individual personality issue. But this postpartum is not built in. It's not part of individual. I was thinking to ask when the concept you will relate with it is something like baby blues or postpartum depression. The narcissism they are on is on its own. They are not. Is a personality issue. Some people are narcissists. They are born to be self-centered. They are born to be critical. They are born, but not a woman that just delivered a baby. And as a result of the process of the delivering of a baby, the biological, the physiological, and everything triggers off. And the hormone, the neurotransmitters were altered due to the stress of 9-month pregnancy and delivering. It's not the same with narcissism. Thank you.
All right, thank you there. Let's take this one from Abdurrahman. Abdurrahman also appreciates Dr. Ndidi for her presentation, and then he goes on to ask about okay, where you were speaking on causes of postpartum psychosis, you listed a number of factors, and but I doubt if I heard of the issue of polygamy. In part of the country where I come from, you see men who marry as many women as possible without proper care for these women. And in a number of cases, you see some of these women suffer this postpartum challenge after giving birth. Don't you think polygamy is a determinant in
honestly,
this case?
Is a very high determinant. I'm happy he mentioned it. So I'm going to add it to my knowledge base because I know that one of the points I mentioned was domestic violence, that is intimate partner violence. I know that polygamy comes with that kind of thing. I know that polygamy comes with emotional neglect. Polygamy comes with lack of spousal support. And all these things can precipitate severe stress. So it is not the polygamy, the act of getting married itself to many wives that will cause postpartum psychosis. No. It is due to the effect, the outcome that as a result of getting married to many wives, such as that neglect. A man who has many wives will not have adequate time to now care for the person who just delivered, because even as you are delivering, somebody else may be in the hospital waiting for another baby. So there's nothing you are doing that is very new. If it's within a period, he has babies here and there because he's a polygamist. He's not expecting that baby with the same expectations you have as a mother to be. And like if you have married a man who has baby before, it's not the expectation of excitement. No, he has pass the experiment. But thank you for calling my attention to that. Thank you.
All right, thank you very much there, Dr. Didi, and thank you for your question, which turns out to be like a contribution. That's Abdurrahman. Okay, let's take the next question from Moyo. Moyo is asking, is it postpartum psychosis that leads to drug misuse, or drug misuse leading to postpartum psychosis, or is it a catch-22 situation? Okay, Dr. Ndidi, I'm sure you got her question.
Yes. The two conditions are interconnected, and that is why addressing both of them is critical for the mother and the baby. The drug, for instance, a pre-existing mental health condition can increase the risk of both drug use and postpartum psychosis. Postpartum depression can lead to substance use, substance abuse. Maybe I should put it in a clearer form. You know that after a childbirth, as a result of the new role of, apart from the physical stress of delivering a baby, there's also the emotional stress of going to care for a new being around you. There's also the stress of sleep deprivation. So these three can lead to postpartum depression. These three can lead to postpartum depression. And some people try to solve the problem of postpartum depression by using the substance. Did I communicate now?
I definitely believe so. Thank you very much
Yes,
there.
that is it.
All right, let me quickly do some more recognitions. Hi on the X space here. Thank you very much, Suleiman. I saw Suleiman walked in. I've also seen Soy Whisperer also walking. Thank you. I've seen Prince Isaac also walking. These are our regulars. I've also seen Pascal Iwebu also just walking. Thank you. I have also seen Ayo Ayeni. Thank you. I've also seen the founder and executive director of Lespada. That's Ambassador Mariam Hassan. Thank you very much, Ajia Ambassador Mariam Hassan. Okay, let me pause it there again. Let me read another message. Okay, this is actually coming from Ambassador Mariam Azan. Thank you, Doctor, for this wonderful presentation. Please, can pre-existing drug abuse increase a woman's vulnerability to postpartum psychosis? Thank you. That Ambassador Hazan.
The answer is yes, because drug abuse can worsen the symptoms of postpartum mental illness and make it more difficult to treat. Thank you.
All right, thank you very much, Dr. Didi. That was a straight one, quick and precise. Okay, this is okay. Mo, you're also coming up with another question. Thank you. I understood your explanations or your response to my first question. Now I have a second question, please, Dr. Ofole. How do healthcare professionals differentiate between drug-induced psychosis and postpartum psychosis? Okay.
That is even a major challenge. That is one of the concerns that it used to disguise, it used to distort treatment, because it's not easy to know what is causing what. But with this technology and with series of tests, it's very easy to test for presence of any drug, uh, traces of drug in the system of that person that has postpartum psychosis. So it complicates, it makes it treatment complicated, because you wouldn't know the one you are isolating. And that is why I'm advocating that integrated care should be that those facilities are together, the one diagnosing for substance abuse and the one diagnosing for postpartum psychosis should be in the same treatment center so that it can be isolated, knocking one off before the other at the same time. Thank you.
All right, this one is coming from OJ. OJ, how can antenatal and postnatal mental health education help reduce the risk of drug-related postpartum psychosis? Is it possible?
It's very, very possible. That is even why I said that this antenatal, there's a the level of knowledge presented is much higher than what is done in postpartum. That if the same drive, you know that before now, due to maternal health, death, and mortality, there was intensive effort to expand antenatal care. That same rigor has not been applied to postpartum. Two of them are achievable if it is done. If it's done, it will reduce that because that is a major problem. Postpartum, either stress or depression or after birth issues, has not received equal attention like antenatal. And it will be a good, it is a new, an area where we can advocate and sensitize the government and policymakers to do something in that regard. Thank you.
All right, thank you very much again, Dr. Ndidi. This one is coming from Vicky. Vicky is asking, throwing up a puzzle here. Okay, let me cut that part off. Okay, for a woman who has a history of drug use or even a drug dependent and then giving birth only to suffer postpartum psychosis, would that kind of a person be treated in the hospital where she gave birth or be taken into a rehab facility? And if so, what happens to the newborn baby? I'll need your insight, Dr. Ndidi. Thank you for all you have said today. All right,
Yes.
thank you.
You see, I during my presentation, part of integrated care, I is having both the woman and the child to be in the same facility. So, on the basis of what is, if it's the psychotic, that reality related issue that is high, it will mean that they will be hospitalized in psychiatric units that has provision for mother and child. Then, if it's substance disorder that is high, it is based on the diagnostic result, assessment of both the psychiatrists and the medical personnel and the child doctor. Is a multisectoral, is a decision that is taken by three known personnel here. The one for the baby, to know how the baby can cope being with the mother, the one for substance, the psychiatric, and the one for medical, the gynecologist, to know which of these problems present more, which one has higher risk factor, which one should be addressed first, or can they be treated at the same center? So if it's higher, they will go to rehab, and while they rehab, they make a provision for mother to child a space. There are many places I've visited for rehab center. It's very conducive. They have one room, they have facilities inside that can take a mother and a child, and the personnel for other issues can be coming in to see the mother and the child. Thank you.
All right, we have this one coming from Fola. Fola is asking, okay, okay, blah, 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 okay. Okay, recently I have a friend who, after giving birth, was kept back in the hospital longer than necessary under the guise of being treated for postpartum depression. Is there a difference between postpartum psychosis and this postpartum depression? Thank you. All right. Please go ahead, Dr. Lily.
Yes, there are differences. Post, postpartum depression has a shorter duration. I think most women have a decreased level, let me say, increased level of anxiety, fear, and so on. So for depressive syndrome, it will go off with a little treatment that may not be as intensive as that of postpartum psychosis. Like we know the name is postpartum psychosis. Psychosis, I have listed some of the things that make it a psychotic issue, is a psychiatric issue that is psychotic. The depressive, every individual at one time or the other can have a mood change between being, in between either day or week or within the period. So depressive will go, it will not require intensive hospitalization or treatment like psychosis, because a depressive person may not have hallucination, may not have delusions, may not be talking to him or herself, may not be believing that somebody want to kill you. But a psychosis, a postpartum psychosis uh, woman or client will have such. Those are the major differences between them. Thank you.
All right, thank you. Let's take this one from Immaculate. Immaculate is asking, from all Dr. Ofole has said today, it's obvious that this postpartum psychosis and the attendant challenges are not things that a fresh mother should actually go through. I would like to hear more about preventive strategies. Can this not be prevented, or can this be prevented totally? How do we build mechanisms in families, in health institutions that would completely shield our women from experiencing or going through this? All right, thank you very much there, Immaculate. All right, Doctor.
Thank you very much, Immaculate. Truly, studies have shown that women that are having their first pregnancy, they have higher risk of postpartum psychosis than those who are coming for it for the first time, because the experience tends to be more stressful for them. It used to be more intense for first time mothers. There are things that can be done, like you said, and that is one of the things we are doing. And we can do it at different levels. You do education, you do substance use and abuse prevention education. You talk about how intense and how painful and how this thing can affect them as mothers and the children and their family. You do extensive education to avert it, because there's a saying that prevention is better than care. And I want to remind us that prevention can be at two levels. If there are, no, three levels rather. If there are individuals who are already on it, you find a way to make them have secondary abstinence. If they have been on drug and substances and so on, you can make them, yes, I know you have been on this drug and you have been on it for a while, but now that you want to enter a family, now you want to, you begin to raise children, you continue like this, there's likelihood that you may have a postpartum psychosis. Why don't you, because of the love you have for your family, your unborn child, why don't you stop? And tertiary is now when we begin to look at it has happened. So there are things that can be done, and it's improved knowledge, strengthening the skill. Even as new mothers, some of them suffer peer pressure. So they could mount problem to enable them to navigate peer pressure. Empower them with refusal skills, assertiveness skills, life skill that will help them to avoid this accepting the substance from their colleagues. And That will go a long way from preventing new mothers from experiencing it. Knowledge is power. Thank you.
All right, thank you very much there. Okay, I have another one from Ibrahim here. Ibrahim wants to know what has changed in the days of our mothers, even in the worst environmental and medical conditions. These things were not pronounced or did not exist at all. Now that we have some good medical facilities and services in place, women are now going through some of these wars and traumatic experiences. Since just a counseling psychologist, but also an academic and a researcher, what has she found out about what has changed between the period of our mothers in the years past and now? Okay, somebody is giving you a huge research work there, Dr.
It's very interesting about this dimension to our discussion. Research has shown that the pain threshold of this generation is not as strong as the previous generation. Pain threshold simply means ability to withstand pain and stress. You know that in our previous generation, people trek a long distance. People do a lot of physical activities to either get a means of livelihood or to support an existing one. But this generation, most of them cannot stand the stress because childbirth and child delivering. In fact, that's why they said they deliver like Hebrew women. Some of them even deliver in their farmland. They will be doing work. They will come to the farm. In the process of doing the work, the baby will just go. They deliver it. Some of them, after delivering, they will still continue with the work. And somebody will help them just pack them up. They are going home. But these days, because they are not physically, they do not, just this generation cannot. Did you know that some of them make a choice of, I will not go through childbirth to say, yes, I want. They want easy way out. They don't want to go through. In fact, I was embarrassed when I was praying for one girl. I would say, don't worry, God will make everything easy for you. When you want to give, I say, God forbid that you never try to go and give a birth to vagina, that it just yes. I was shocked. So that is one thing that changed. Another thing that changed is this media. Social media is glamorizing things that shouldn't be. Everybody want to appear stressed. Everybody want to look elegant throughout their life. But I know that motherhood has elegance. The stresses and pain that come with it is the elegance that it has and the respect it has. That is second thing. The third thing, in the past, sometimes studies, there's evidence that the fathers of the past, they appreciated what the woman is doing. Now, the question is, what did you bring to the table? What did you bring to the table means that this generation, likely, they are not understanding that the process of childbirth itself is stressful. It's mentally and psychologically excruciating to ask, what did you bring? So this generation will make sure that instead of going through those pain, you should use your money to solve the problem. They don't want to be involved too much in the marriage. So thank you.
All right, thank you very much, Dr. Ndidi. I have this one from Omotunde. Omotunde, that's a lady, definitely, because of this question. Okay, blah, blah, blah. The Omotunde wants to know, there is a complex situation here. A new mother is struggling with the issue of substance abuse and postpartum psychosis, and is being taken through treatment, does this on the long run have any consequences on the psychology of the newborn child, especially as it regards um, substance abuse, since this same child will be consuming breast milk from the mother? All right, thank you, Omotunde there. Dr. Ndidi, please go ahead.
No, it doesn't. If medical examination has been done, especially if the mother is under medical care, if they examine that the substance being taken is not manifest in the breast milk, I'm sure they will allow it to continue. But when they notice there is a threat to the child, they will stop. They will advise that the child should be given artificial. So we cannot walk ahead of the medical personnel. They advise, they put into consideration those things. But I know that where it is most affecting is if there's no that bonding, if the child is not being given to the mother to bond, to care for. But sometimes when there's an issue of postpartum psychosis, if the child can cope without that breast milk, they resort to it, to resort to artificial feeding instead of that, you know. So that is it. It's only in bonding that is affect. Thank you.
Okay, all right, thank you very much. Okay, there is a question also closely related to that. I'm just seeing this now. Okay, this is coming from Omomba. Omomba, how can healthcare providers balance the needs of the mother with the needs of the child in cases of postpartum psychosis and substance abuse? Okay, I think the other side has been answered earlier. Okay, Dr.
Yes.
Didi, did you get that? Please go.
Yes, I did. I mentioned about having a comprehensive health care that will take care of the mother and the baby, the unit. That is a part of the integrated care. So instead of separating both, they are in the same facility for treatment, depending on when the mother heals.
Okay. This Abu, there is a question from Abu here where we have barely 5 minutes left. Okay, I'm just running through the questions, skipping the ones that had been answered or that your responses are taken care of, and then just picking some of. Okay. This one from Abu. How do we address the stigma coming with postpartum mental illness and drug abuse simultaneously? Because in a lot of families, the woman is seen in bad light, especially if it's someone that has a history of substance abuse, and then when the issue of postpartum psychosis comes in, family, especially of the husband, will see her as reaping the consequences of her substance abuse. How do we destigmatize this problem? Okay, thank you, Abu. Dr. Didi, are you there?
Sorry, I'm there.
Okay, you are muted. Okay.
You know, we talk about family-based therapy. The essence of family, why family should be involved is because of purpose of stigma. Because there's a saying that once a family member is infected, everyone is affected directly or indirectly. The cost of caring for this individual who has postpartum psychosis will be borne by every one of them, either directly or indirectly. So that is why there's need for family-based therapy, whereby the spouse is brought on board to discuss about the consequences of if this child, both the mother and the child is not cared for, what could result. The in-laws, the extended family, all these are efforts to mitigate the impact of stigma on a woman that is having postpartum psychosis. Thank you.
All right, thank you very much. We have come to that point when what we want to do now is just to take your final remark or final take on this program today before we draw the curtain. We'd like to appreciate you, Dr. Ndidi. But first, let's take your closing remark and then we'll come back to formally close the space. You've been with us for almost 2 hours now. That's very great, awesome. Thank you very much. We not taking that for granted. Please go ahead with your closing remarks, Dr. Ndidi. You are muted. Dr. Ndidi is muted. If you can hear, okay.
Yes, I've heard you. I want to conclude by saying that the consequences of undiagnosed or untreated postpartum psychosis are severe, both for the mother and the child. It could lead to high perinatal mortalities. It could lead to mother-infant bond being disrupted. It could lead to risk of violence. It could lead to worsened symptoms. As a result, we are talking about treatment innovations for postpartum psychosis, which entails moving beyond medication. We should emphasize that it's only medication that can cure postpartum psychosis. We should move and culturally is given a combination of medical technology and compassion. Recovery is not only possible, deeply transformative, allowing the mother to reclaim her joy, the connection, and the hope for life. And I look forward to a Nigeria whereby the level of stigma will be reduced so that women that has postpartum psychosis can be looked upon passionately and be supported so that they can contribute their quota to the Nigerian nation. Thank you once again for the opportunity. I'm indeed grateful.
All right, thank you very much. Dr. Ndidi Mercy Ofole is an associate professor of counseling and health psychology at the Department of Counseling and Human Development Studies, University of Ibadan, Southwest Nigeria. Indeed, a well-read woman holds 4 distinguished degrees from the same prestigious institution. With over a decade of impactful experience in research, teaching, and community engagement, Dr. Ofole's expertise cuts across multiple domains of counseling and health psychology. Her areas of specialization include health counseling, mental health, school and educational counseling, gender and inclusivity, adolescent reproductive health, positive psychology, stress management, and organizational well-being. Importantly, she is also a recognized authority in substance use prevention, treatment, and recovery, where she has developed innovative frameworks for reducing youth vulnerability to drug and alcohol use, championed evidence-based recovery programs, and worked on community level interventions that strengthen resilience against addiction. She's been speaking with us for about 1.5 hours now. She's been with us actually from the onset. That's 2 hours now. Thank you very much, Dr. Ndidi Mercy Ofole, for your time with us. We appreciate the insights shared and the great knowledge and all of those explanations. We encourage everyone to, after this conversation, the recording is available on all our platforms. That's at NDLA01 on Facebook and at NDLA TV on YouTube, as well as at NDLA_Nigeria here on X. So we are free to share them with our friends, our family members, and our associates so that they can also benefit from this great conversation. We'd like to appreciate everyone who have joined us from across Nigeria, those in the northeast, northwest, north central, south, southeast, and southwest of Nigeria. Thank you, everyone. And all our compatriots who often join us from other parts of the world, thank you very much. Talking about those joining from other parts of Africa, those in Europe, America, Asia, and the Middle East, thank you for keeping faith with us. We'd like to also appreciate all our regulars on the platform. Thank you very much, Pascal Ewebu. Where? Okay. Iransha Lady Mary, thank you very much. Soy Whisperer Suleiman, Prince Isaac, thank you, most especially Ambassador Mariam Hassan. That's the driving force behind the Lespada initiative. Thank you very much, Ambassador Hassan. I would like to appreciate also my colleagues working with me behind the scene here. Thank you very much, Francis, Dele, Mahmoud. OS is there. Kumbi, Victor in Lagos. I would also like to appreciate my deputy, that's Lady Rita. Thank you very much. And all of you that may not be able to mention, I appreciate all your contributions. Thank you very much. Would definitely be coming back with another topic and another guest speaker, hopefully next week by the grace of God. Until then, please ensure that, like we often say, thank God it's Friday, but then please let's keep within safe everything we have to do. Please let's ensure that we have our eyes on our safety and ensure that we don't do things out of order. Especially, we can all avoid substance abuse. Like they say, prevention is better than cure. Until we come your way next time, I remain yours sincerely, Femi Babafemi. And I leave you in the hands of my colleague now. Mahmoud, please go ahead and close the space. Thank you.
Thank you very much, sir, Mr. Fumba Fumi, the NDLA's Director of Media and Advocacy, for guiding us throughout today's program. For more information about the NDLA, our listeners can visit our website www.ndla.gov.ng. Our social media platforms remain at NDLA_Nigeria on X, Instagram, Facebook, YouTube, and Thread. On Facebook, it remains at NDLA. Do join us same time next week for another edition of this wonderful program. Bye bye.